Hospital workers of Reddit, what's the creepiest thing you've ever seen? Psychological Bus 7357 said, I am an ICU nurse. I had a patient who was declared brainstem dead. The family did not want him to become an organ donor, so we withdrew treatment. I switched off the ventilator, pumps etc. and extubated the patient. A few moments later the patient displayed Lazarus sign, which is a reflex that causes the patient to raise their arms in the air. I was by no means new to the role, but this really scared me as I had never even heard of it, let alone witnesses it. Las Ruas said, my aunt made the Lazarus sign just before she passed. Life support had been withdrawn. It was so creepy after weeks at her bedside watching her motionless with just the machines doing the breathing. I nearly shit myself as I was holding her hand. The nurse told us how unusual it was. She'd been an ICU nurse for 9 years and this was the first time she'd seen it. You can find videos of it on YouTube if you're a ghoul who is interested. It's not a creepy motion as such, just very creepy in the context of the moment. Doodle said, I don't have a single event. But from working nights in the operating room of a level 1 trauma center you run into many awful things. Including the worst of society. But something that sticks with you is seeing a severely injured person in complete shock. Not like wow my arm is off, but like body shock. They're barely aware of the world around them. Eerily calm. Pale, sluggish. Not at all bothered by the bustling room around them. I remember one person who had a ruptured aortic aneurysm, and due to a communication breakdown we had incised before the patient was asleep. Surgeons get tunnel vision in moments like that, and the patient was like, hey, that hurts, very chill, almost bored. It was wild. Perfect Suggestion 2 said, you absolutely want to do what you can. My mom is a retired RN, 77 years old. She said repeatedly that she has a DNR order and under no circumstances is she to receive extraordinary care to try to revive her if she codes. She knows very specifically what chest compressions do to a person and what it would be like for a frail, 90-pound-old woman to try to recover after every bone in her chest was broken from CPR. For example, she's also seen what life is like for someone who is revived after coding, and it is usually not pretty and not a pleasant way to live out the rest of your life should you even marginally recover from the efforts to save you. Perfect Suggestion 2 said, I remember being in this state once. I had a ruptured ectopic pregnancy and was bleeding internally. I had been walking around my house in shock after taking a shower when the agonizing pain hit. I was slowly bleeding to death internally, but a friend miraculously stopped by unannounced and saved my life. I was going to have a lie down and take a short nap to sleep it off if they hadn't shown up. I remember being irritated with my friend for interrupting my beauty rest. In the ambulance on the way to hospital, I was just chatting casually with the techs in the ambulance on the way like I'd sprained my ankle or something benign. It hurt like you would expect it to hurt when your internal organs tear, but I was just casually, like, am I having an anxiety attack or something? When I saw my solo I shouldn't be conscious blood pressure reading on the screen. I remember hearing a nurse get dressed down in the hallway after my ultrasound. She had asked me to go empty my bladder before the procedure. I explained I didn't think I could walk. She insisted and left the room. I got up and shuffled across the room, holding onto the wall and any medical devices I could reach to stabilize myself. I don't remember anything after that. Start Talking Sense said, my mother had a student teacher who was at last pregnant, after 8 miscarriages, and finally IVF. She was having a perfect pregnancy, was just over 8 months pregnant and was going home from a hospital checkup. They were halfway home when she screamed out to her husband, we have to go back to the hospital, now, something is wrong. One hair-raising illegal U-turn later, they were speeding like crazy back the way they came. She said they raced up to the emergency depot and her husband was yelling for help as they went inside. She was rushed into surgery for an emergency C-section just seconds before the umbilical cord detached and the baby was about to die due to oxygen deficiency. They saved the baby. The DRS said 3 minutes later would have been too late. She had no idea how she knew something was wrong, but she said it was such a feeling of dread and foreboding she knew it was life or death for her baby. Had she ignored it, her baby would not have made it. Perfect Suggestion 2 said, thank you. I appreciate your kind words. Oh, I'd have died, for sure. I was just going to go to bed and my husband wouldn't have been back from work for another 8 hours. The reason it wasn't detected was because I was such a fit, Classic presentation of pregnancy at my first OB-GYN appointment, 2 days before kicker. I was 41, first pregnancy, considered high risk simply because I was older. In fact, I'd felt like an Amazon due to the pregnancy hormones, and that morning, was digging a heavy shrub out of my garden as my doctor told me to continue with my usual day-to-day activities, which I had explained were very physical. The day after my doctor's appointment, day before the rupture, I had called to let them know I felt an odd fluttering low and to the right and had some spotting. It was decided that was normal, and of course, that's within the range of normal experiences. They told me an acceptable range of pain, spotting, tiredness to experience, and to call for an appointment if I exceeded that. 24 hours later, the slightly strange thing is that I never felt quite the same after that. I did lose a lot of blood and it took ages to recover because it wasn't enough blood to justify a transfusion. I have no idea how much of the bleeding itself is blocked from my memory. Start Talking Sense said. At an old job I was the shift first aider when one of the guys rushed in from a machine room and said, "Come quick, X cut his finger off." I was close to the cafeteria so ducked in, grabbed a clean dry tea cloth, dampened it with water and got to patient X. He was white as a sheet. We elevated his hand. There was almost zero blood. Wrapped his hand in the retrieved severed finger and the tea cloth, and one of the managers drove him to hospital. Hazards, high beams and horn on continuously as they drove down the center line of a busy road full of Friday night rush hour traffic. Amazingly, everyone got out of their way. I phoned the hospital and warned them that they had an incoming amputation. They were outside waiting for him. He was in theater inside the golden hour and they managed to reattach the finger. He was left with a white scar that circled his finger and only being able to curl up his finger 90%. He was very lucky. The finger worked fine for the rest. Through it all, it was like everyone else was racing around at high speed and he was totally in slow motion. He was completely calm, told us how it happened, answered my questions about his blood type and other stuff, allergies, allergic to latex or penicillin etc., his wife's phone number etc., no panic, no blood, no pain. But I've never seen anyone living with such a white face. He was in total shock. He remembered absolutely nothing about any of this later. From the moment of the accident to after surgery was a complete blank. He said it hurt like hell afterwards when he was recovering though. Riot Hyena said. I worked in the kitchen, so I was the lowly peon delivering food trays. Delivered to one guy who had a horrendously infected foot. Most of the toes were necrotic and black and the rest of the foot wasn't doing much better. I wouldn't be surprised if he was waiting on amputation. His dietary requirements were diabetic, so it was likely. The room smelled awful. Anyway, these rooms are small, with typically 2 beds in them. Because of the smell from his infection, the other bed is empty. I still have to squeeze by the foot of his bed, and as I'm paying attention to the tray so I don't knock it into equipment, I accidentally brush my leg against his infected foot that he has sticking out of the covers and hanging off the bed. His big toenail comes off onto my leg. It's just stuck to my leg. We look at each other in horror. I clear my throat, ask my usual questions, clear and adjust his table, give him his tray and wish him a good day. I leave calmly, and then run to the nurse's station and ask for help getting this dude's entire necrotic toenail, with bonus flesh, off my fucking leg. The nurse who got it off soaked a portion of my pant leg in some disinfectant liquid that smelled like it could take the paint off a car. Start Talking Sense said. After a bad accident I had one of my legs in plaster for 16 weeks. After it was cut off my skin was mega white and pale. The nurse told me to go home and take a long bath. She smiled, ha ha, she knew. Turns out that white skin was dead skin that people usually lose every day in small amounts. Mine had had nowhere to go for several months, so literally just peeled off my leg like wet cardboard. Hand-sized pieces at a time. It suddenly looked like it was snowing or someone had added a bath bomb to the tub as it broke up into a fuzzy mass in the water. It was both gross and seriously amazing at the same time. Except for where the multiple large surgery scars were, the skin underneath was pink, perfect and newborn baby soft. Poor husband has the less ravishing job of cleaning the tub later because I couldn't use my legs. Riot Hyena said. Yeah, me neither. I know the nurse who helped me said she'd let Foot Guy's nurse know about the incident, but like, nothing more I could do about it besides take a deep breath and move along. I have so many stories from that job. The kitchen was in the basement, right across from the fucking morgue door. A lot of people were worried about ghosts or whatever from the morgue, but since I did most of the work in the actual hospital floors, I saw a lot worse than ghosts. I'd rather deal with a spooky apparition down the hall than what I did have to deal with, like pinning myself against a wall trying to be invisible as a dude flipped out and got violent with the nurses, or having to deliver a tray to a dementia patient who fucking lost it and started screaming like she was dying because the nurse forgot to mark that patient's food orders as delivered to nursing, so she acted like I was the fucking Antichrist because she'd never seen me before. Block Wide said. Before he died, my grandfather kept talking about how he was working at this plant he hadn't worked at for 30 years or more. As he went downhill, he kept shouting for people to come fix whatever problem he thought was going on at that plant. I'd have to tell him people were on lunch break and they'd be right back and stuff. What gets me is, as he got worse, the plant got more dire and he'd become so much more distressed trying to tell us how off the readings were. I think a part of him very much knew he was dying, and that's how it was translating that. Kyring said. Every hospital has a couple rooms super close to the nurse's station where you put patients who needed extra eyes on them. So either crazy due to drugs, dementia etc. or dying. The first hospital I worked was special though. I'm a skeptical person, but I saw dozens of patients react to watchers in those rooms. The watchers came in two flavors. Patients who were detoxing from drugs, alcohol, or violent and unpleasant towards staff would talk about a menacing shadow figure who was there to keep them in line. There were a couple frequent flyers who would assault staff during admissions to other rooms, but not the watcher rooms. Patients who were dying, confused, or experiencing non-violent mental health issues would also see a shadow figure, but it was calming and protective. I had patients talk about how the shadow kept them from falling out of bed, picked up the call light if it was dropped, all sorts of little things like that. It didn't happen with every patient, but enough to make me wonder. Chwiz said. I've had some health problems lately after being isolated in my room for a few years. I'm pretty sure I'm starting to get a mild schizophrenia, but this comment makes my heart drop a bit. I sometimes think I see movement in the corner of my eye, but when I turn to see there's nothing there. The only time I do catch a glimpse of the shadow figure is when I'm brushing my teeth and looking in the mirror. Always behind me. Our laundry room is directly in front of the mirror and we keep the lights off when it's not being used, which is what I think my mind is misinterpreting. I always see a lanky figure with a top bowler hat standing there. I don't see it for long every time. Usually less than a second, but I definitely see it. Or should I say him? It always gives me a calming feeling when I see him, rather Tom, the creepy feeling you'd imagine you'd get in this situation. Anyway, I've decided to call him Tom. I like to think he's there to make sure I take care of my dental hygiene. Gilbeard said. EMT for the ambulance service. We have two hospitals in our county. One is a general hospital and the other in level I, a trauma center that most people go to. Even then, last week both ours were filled to the point where the general hospital told us they could no longer accept patients due to being filled up. In the level I would only take patients under certain circumstances. While my partner and I were in the ER, we kept noticing a man laying in a bed out in the open that looked so peaceful as he was sleeping. We found out from RN we knew that he had died from unknown circumstances, but they had nowhere to put his body. The morgue was full and no one could track down the county coroner. All they could do was make it look like he was sleeping so the other patients didn't take notice. I thought it was very unethical, but the RN kept reminding me that they had absolutely no room for his body unless they put in the janitor's closet. Block Wide said. God, that's really rough. I'm so sorry you guys are also feeling the surge where you are. Before COVID, my team used to do house calls as well, and occasionally part of the job is coaxing survivors through allowing the body to be transported. My very first call, I spent a good 2.5 hours sitting on the roadside next to a woman and her very dead partner. The one that really haunts me though is we got called into a chaotic scene where a man had just died and his roommates and grown kids were extremely upset. He was a recent cancer survivor, but they said he'd developed a really bad cough in the past few weeks. They asked me to go get the son out of the bedroom so they could transport the body. There was so much blood and it was splattered on the walls like coughing, not like vomiting. I've seen actual murder scenes with less blood. His roommates were fully traumatized, saying it looked like he coughed up a lung all of a sudden. The son and I ended up talking about how much his dad had loved working at the airport. This was early December 2019. I still wonder if we weren't staring right at a warning sign without knowing it. Funny Quit 5804 said, I was walking into the hospital cafeteria and see a guy crouched down behind a trash can wearing a gown and holding his IV port. He was an interesting looking fella, sorta trashy looking, and wearing only the gown, so he was quite noticeable. I see security running in and watch him crouch down lower. Officer Manpants, a female security guard I've affectionately nicknamed, finally spots him and yells at him to come with her. He jumps up, screams "Not you again, bitch," then pelts her in the face with an open carton of milk. Chase ensues. I go back to getting my breakfast. Turns out, he was trying to leave with his IV port attached so that it gave him easier access to shooting up. Pretty common practice of drug-addicted individuals in a hospital setting. We always let these people go AMA, against medical advice, but we let them know we must remove the port, per hospital policy. It rarely works in our favor. Ebert 175 said, I got a fast bleep, i.e. drop everything you're doing and attend this emergency please. One night to a side room on the ward to find no patient in the bed. Was just about to leave the room and go back out to the nurse's station, where there had been a bit of a hubbub when I dashed past the first time, when something caught my eye. Looked up to see a face with wide, slightly wild psych eyes peering down at me from a gap in the ceiling tiles. She was a lady waiting for a bed in the psych hospital who'd clearly thought the ceiling was the best place to hide from the people trying to poison her. Honestly, can't think of another occasion that I've been quite so terrified. Worst thing was that I had to walk, back out underneath her to get help from the nurses and security to get her down. Purposely Distracted said, you guys need a little levity after reading all these? Worked the ER as an AF medic, Aglin AFB Hospital, FT. Walton Beach, FL, resort area, pristine white beaches, sport fishing. Took a body down to the morgue with another medic and shift supervisor. He had the drawer assignment and paperwork responsibility. We pulled open the drawer and there was a monstrously large sailfish that could hardly fit without its body curved and sail pushed down. We stood there in surprise. Procedure? No idea. Then Co said, it would be a very good idea not to remember this. I'll deal with it in the morning. Let's see, how about this drawer? Later it was rumored it belonged to one of the senior surgeons. Mist Manor said, I am sorry that this is off topic but I feel I must add a story here, for information that may save a baby's life. I was over 35 so my doctor, in Lebanon and he is US trained, insisted on an ultrasound every 5 days in the last 2 weeks of my pregnancy to check the amniotic fluid. My friend who was my age as well was also giving birth around the same time in Phoenix. She was only allowed one ultrasound during her pregnancy. Her HMO wouldn't allow more and she didn't know that she was supposed to have more ultrasounds in the last 2 weeks. The amniotic fluid dried up and her baby died at 9 months of gestation. So she had to deliver a deceased baby. Every Gino knows about this risk and it's criminal that over a simple scan that shouldn't even cost extra because the machine is usually right there in the office, babies have to die in the USA. Sorry about my rant but this neglect is unbelievable. If you are having a baby and you're over 35, insist on more end-of-term ultrasounds even if you have to pay for them out of pocket. I asked her if she was going to sue and she and her husband were so grief-stricken that they didn't want the additional aggravation of a lawsuit. Tragic. Social Media Sanity said, I am so sorry that happened to her. The truth is, we have done hundreds of studies on ultrasounds, fetal heart rate monitoring, induction early and dozens of other interventions and nothing has been able to reduce late-term losses. I have seen women get twice weekly ultrasounds and BPPs and still lose a baby. We have gotten better at identifying complications early and intervening but even then it has only been found to reduce complications, not deaths. If it actually saved lives we would be doing it, but it doesn't. Routine ultrasound monitoring for fluid level is just one way to identify low fluid which is just a symptom of other placental issues. Ultrasound will just give us a number which doesn't always correlate to risk of death. Like I said, we are in the business of birth, not death, and if we could save these little lives, we would. Apprehensive Son 1445 said, I was a supervisor over the admissions department of the emergency room in a very small hospital in a rural area. I had 2 people call in one night, so I had to go in and work by myself. Around 3 a.m., Ems arrives with a patient that shouldn't have been brought to our hospital. She was DOA. Being in the admissions department meant I had to do all the paperwork when patients came to the hospital. I walked into the room with my clipboard and saw a woman on a stretcher with a dog chain around her neck. She had claw marks all around the chain where it looks like she had tried to get the chain off. M stated that in the process of hanging herself, she changed her mind, but it was too late. Gave me chills. Trey Nguyen said, "My wife is transitioning away from working nights at an assisted living facility. She said for about a week after one resident passed on the memory care side, all of the nursing assistants would randomly hear someone with a walker moving around. Walkers make an extremely distinctive noise when one walks with one, except they have sensors everywhere so they know when someone's up, and every time nobody was up, and they could not find anybody that was up upon walking around looking for the source of it. She's also told me that this job has convinced her that ghosts are real." Hefepe said, "Okay, so here are a few nursing home stories. The nursing home I worked in used to be an orphanage. The seasoned staff would say stuff like sometimes the residents see kids, and I laughed it off. One morning I was getting residents out of bed and one of our ladies was staring out the window. She stopped me and said, 'Give those kids a blanket, they'll freeze out there.' And then another night we had a resident who wouldn't stay in bed. She had bed alarms so we would hear her get up because it wasn't uncommon. She shared a room with a nonverbal stroke patient named Maggie. One night she was way more active than usual, that alarm going off every few minutes. I went in there and was like, 'Mildred, what's up?' And she said, 'There's a man under Maggie's bed.' I squatted down next to Maggie's bed and I said, 'I don't see anyone.' This woman said, 'I don't see how, he's looking right at you.' I was out of there immediately and didn't go back in. It wasn't my patient on my hall, I was visiting between rounds." MRS Captain Kirk 2009 said, "I was working alone overnight on a call out for a radiology exam. Time is about 3 a.m. My department is empty and no one else is around except for me and my patient. I hear something wheeling down the hallway, which would have been odd for the time of night and the location of the department. I poke my head out of the camera room and no one is there. I go back to my patient and camera. Again I hear the wheeling. I look down the hall again and no one is there. So I'm standing near my patient and moving the camera to the next position and I get the feeling I'm being watched. So I turn around and there was a completely dark human-shaped figure standing in the doorway watching. I immediately turned to go investigate who was in the department and no further signs of the human-shaped figure and no one in the hallway. It was very quiet after that and no other strange sounds that night. It made for a very unsettling evening." Blockwide said, "My contribution, I'm on an on-call victim support team, so I often end up at the hospital at odd hours. This was around 4 a.m. I just finished doing my thing, and I was sitting in my car in the parking lot collecting myself and writing notes for my report when I see someone out of the corner of my eye. I clearly saw the blue of a hospital gown, but when I looked over, no one was there. I figure I'm just tired and riding out the adrenaline of the call, so I go back to doing my thing. After a few minutes, I once again spot something out of the corner of my eye. This time when I look up, someone is there. Standing on the curb in front of the hospital, I see a man in his mid to late 50s, thin hair up top, no facial hair. He's wearing a hospital gown and holding on to something metal, but from my angle, I couldn't tell if it was an IV pole or a crutch. He wasn't leaning on it. He had this expression on his face of wide-eyed shock with his mouth slightly open, like he was trying to think of something to say and had totally stalled out." Blockwide said, "At this point I start glancing around for staff or something, because this man doesn't look like he should be outside alone. His skin is a messed up pale color, and he's barefoot. I can't see his feet well with the shadows, but his hand and fingers look bruised. As I'm looking around for staff, our eyes meet, and I know he sees me. I start thinking, okay, this guy can't wander around alone, half naked and unmasked. I have huge chills, but I turn to grab my mask and get out of my car to help guide him back inside. When I look up again, he's gone. I looked all over the parking lot for him, but he was gone. There's no way he could have vanished like that in the split second it took me to grab my mask. I don't know how to explain this without sounding dramatic, but my skin crawled when he looked at me. He looked like a guy who was slowly realizing he died and didn't know what to do now. I still think about it. Silfa, a username, said, I recently had to confirm my first death. It was late at night and I had to deal with quite a few things first that were higher priority, so it had been a while between the person passing away and me getting there. I've seen dead bodies before, but this was my first time getting really close to one, because if you don't know, there are certain things you need to do to confirm a death, such as check for pulse and breathing for a decent amount of time, which means you were in contact with the deceased for a fair while. I don't like calling it creepy because death is natural and I don't want to feel as if I'm in any way being disrespectful, but it was certainly unnerving because for one, his skin was very cold and that's a really big deal when you're so used to the warmth of living people. Second was that the person was caught in the position of their last breath and I kept sort of hoping that they would complete it. Also, being as it was late at night and I was near the end of shift, I was rather tired and a lot anxious. Out of the corner of my eye I kept seeing movement. I'm still sure he was dead because I did really check, but it messed with me a little. Candrew 2012 said, worked in an ER for a long time and overnights while I was in the Air Force. All of the housekeepers would talk about the lady in the red dress. They would often see her down in the basement where the morgue was. We would have to go down there to the place where they did sterilizations to drop stuff off, and that was right by the morgue. No one ever saw anything. One day, a patient came in for a knife cut on his finger and needs stitches. Young guy, no history of mental illness or anything. He was telling me how it was difficult finding how to get to the ER and ended up in the basement, until a nice lady in a red dress told him to go the other way and up the stairs and he found us. We believe the housekeepers after that, haha. Ali Ayun said, I used to work in a geriatric psych unit. We had one patient who was declining physically and mentally, so orders were put in for this patient to be watched 24/7 for safety reasons. I was in the room with the patient and she was laying down on her bed. I see her with her eyes wide opened, terrified and looking at the end of her bed. She slowly moves her eyes up to the ceiling and points at it and murmurs something and is showing visible fear with whatever she is seeing. I'm assuming this is a hallucination and so I try to comfort her. She seemed fixated on what she was seeing as she points at it. Then her eye slowly moved from the ceiling to looking right behind me and she looked terrified. That shit scared TF out of me. Wime said, as a student I was given the opportunity to tend to donor enucleation, removal of eye tissue for potential transplant or research. The patient was deceased and the donation was for research. I had never witnessed such a thing in training as it's rather specialized and I tend to work with living patients, and, to be completely transparent, I thought my preceptor had said, colleague name is going to get some ice. Did you want to assist? I literally thought I was going to help him get ice. In retrospect it made zero sense, but I was very new to the placement and keen to impress, so I immediately jumped aboard. When we got to the morgue I realized something was up. It took no time for me to reassemble the word I had misunderstood as I donned appropriate PPE and was escorted into the cold room for retrieval of the eye tissue. Thankfully, my mentor was not expecting me to participate as I stood frozen next to the deceased patient who was post-autopsy, not covered up on her slab. Incision just kind of laid back in place on her torso, and I spent the next 20 minutes nodding enthusiastically, attempting to appear as if I had knowingly engaged in this lesson from the start. Wime said, the actual removal of the eyes was not too distressing. Tissues, fluids and procedures were not unfamiliar in training with live patients, but the view left behind haunted me for a few years. There was something so unsettling about that patient's body lying there exposed on a narrow metal gurney, incision across torso with her eyeballs removed from her head. Because it was well post-mortem, the eyelids could be pulled down respectfully, but they just kinda popped back open with nothing beneath them to hold them closed. 20 years later I've seen things that make an experience a walk in the park in comparison, but that image popped immediately into mind when I read this question, so thought I'd share. Sleep well, friends. Semicolon. Yesterday Alherd said, I've used to be an army combat medic, now I'm a firefighter medic. I've seen some things. The oddest one was, doing a transport from a horrible car crash rollover. Jaws of life and all to get this woman out. We kept her stable the whole way to the hospital. I personally held her in as she was gurney inside to the doctors. I had a feeling she wouldn't make it. She lost a metric ton of blood. After the handoff and paperwork documentation, which was fairly quick, I went to the vending machine to get a much-needed caffeine boost. As I'm walking out the ER doors, I swear the same woman we just wheeled in is walking out of the ER in full clothing, no blood or damage to herself. She looks me in the eyes and gives a smile. I freak the fuck out. Check back with the nurse station where she says I'm crazy. The doctors declared her dead 10 minutes ago. Sleeping doc said, I'm a med student and get to see pretty gross stuff on a regular basis. But this once was unusual. In came a 16-year-old girl with her belly as large as someone who's about to give birth. Only thing is she refuses any history of intercourse. We do a scan just to be sure, and damn she is right. It's just fluid. Difficult to determine what it was actually. Seniors docs were suspecting ovarian cyst. Later in the operation theater, they went for an exploratory surgery, trying to relieve the girl off the pain and other problems that accompanied such a huge abdomen. They suctioned out a total of 11.5 liters of blackish turbulent fluid. It just wouldn't end. I like to joke about it with colleagues as she lost almost 12 kilos in there. Trust me, it must have been so difficult for her.